Namaskar, my name is Dr. Ajoy Kumar. I'm a member of the National COVID Task Force announced by Mrs. Sonia Gandhi. The job of the National Task Force is to work along with all citizens who believe in the idea of India and with the huge challenge of COVID in front of us, to mobilize as many people, friends, citizens, well-wishers, workers to fight against this terrible disease. In this context, the Indian National Congress social media has already sent out a message to all our COVID sevaks, people who will be in the front line in helping our brothers and sisters. One of the major activity which the Indian National Congress has decided to take is to get all our COVID sevaks, and we are around 2 lakhs, more than 2 lakh of our colleagues are in this movement, to help in registering on the COVID app people who are between 18 to 45 and to take people who are above 45 for getting their vaccination, registration vaccination to different centers. So the work of this COVID sevak, which we are with our pool of 2 lakh COVID sevaks and brothers and sisters, is to help in registration of people between 18 to 45, because lots of our citizens in the country, lots of our friends, lots of our family members are not able to register on the COVID app. Some don't have smartphones, some are not technologically savvy. So we need to go to their houses, reach out to them and register help them through their mobile to register them. And the second is to take as many people who are above 45 to the various centers across the country where the vaccination is happening and helping them to get registered and then get vaccinated. The aim of the Indian National Congress is that we, through our COVID sevaks, vaccinate the maximum number of people, facilitate their vaccination, ensure that they are able to log in and get their date in which they'll get vaccinated, so that they and their family and India can remain protected. Why is vaccination important? Vaccination is important because this is one of the most powerful way to protect your family, your near ones, and yourself and the community. When you get vaccinated, when you take a vaccine against COVID, you ensure that you not only don't pass on the virus to others, you also protect yourself. And right now, in all our arsenal or weapons against COVID, one of the most powerful shield we have is vaccination. Now, those who are between 18 to 45, the government of India has said that they need to get themselves registered on the COVID app. Now, so this is where our COVID sevaks come in. Our COVID sevaks will facilitate in helping registration of our brothers and sisters between the age of 18 to 45. So what are the things you need to do? First, you identify the person, then the family you want to facilitate the registration. You need to check whether they are 18 and above and below 45. Step 2, you must make sure that they have a valid photo ID which is being which the government is ready to accept. Aadhaar is a good example. So take their Aadhaar. Then you open the COVID website or the COVID app. You open the app, you register the person's name based on his ID. You will get an OTP. The OTP number has to be entered and then you are registered. Then the date in which your vaccination is due and which center you are allotted will come and you will go for the vaccination. In case you get Covaxin as a vaccine, then you have to take your next, ensure that the person gets the injection after 4 weeks. Please inform him. And in COVID Shield, the government has said that the gap between the first injection and the second injection is 12 to 16 weeks. So once you have finished the first injection in Covaxin, after 4 weeks, you'll go again for the second shot to the vaccine center. India has right now in its vaccine program has got 2 vaccines. One is COVID Shield and one is Covaxin. Both need 2 doses. In COVID Shield, the gap between the first dose and second dose, the government of India has now said 12 to 16 weeks. In Covaxin, the dose between the first and the second dose is 4 weeks. If you need any information, you can see there is a link in my presentation. You can click on that YouTube COVID website and there's a YouTube link and it is also self-explanatory. Why is the Congress doing this? The reason is the registration on the COVID app is not an easy process, especially for the majority of the people in this country. So you can use their phone and help them in registering and facilitate the process. In the rural areas, the registration of 18 to 45 is also happening in the community service centers. Most of you are aware, but some of you may not be aware that in every panchayat there is a community service center which facilitates application for your ration card, for your old age pension, for other documentation with the government. So similarly, in the rural areas, the community service centers are also the spots where you can go for the registration for 18 to 45. And this is the place where you can go, and our COVID Sevaks will support them in getting registered. So the idea for all the COVID Sevaks is in your community, and we're not asking you to, in your community, your neighbors, nearby, people who you work with, friends, outside your society where you live, in your village, in your town, in your colony, identify people who have not been registered, educate them on the registration, educate them on the vaccination, register them through their mobile on the COVID app, explain to them that they will get a reminder. If they are very poor or unable to travel to the center, then see whether you are capable of facilitating their transport. All of us may not be able to, but in case you are able to, that will be wonderful. Then also advise them that they will get a second reminder for the second dose and continuously keep in touch with them. Our request from the Indian National Congress is that please put up your photos with the people you are helping. Because the leaders in our party, whether it's Mr. Rahul Gandhi, the Congress President, Mrs. Gandhi, Sri Rahul Gandhi, Ghulam Nabi Azad ji, who is the chairman of our task force, and all senior leaders, Mrs. Priyanka Gandhi, and all the chief ministers of various states, would love to recognize and facilitate felicitate, our colleagues who are involved in this. Put your photo in WhatsApp. Please put your photo in Facebook. Please put your photo helping people in registering on Twitter. Tag the Indian National Congress so that we can also get to know how much you're helping. This is truly God's work in helping each other. And I'm sure you would come forward in fighting this menace of COVID and helping our country to get back to normal. Couple of frequently asked questions which are there. People will ask you. One of the common question is, can a person who's got COVID get vaccinated immediately? Now, the government says that people who have got COVID should defer their vaccination, but by at least 6 months is what the government panel has now recommended. Earlier it was 14 days, but now they're recommending at least 6 months between your being having COVID and getting vaccinated. Is it necessary for people who have got COVID to take the vaccine? Yes, it is necessary for every one of us to take the vaccine. How will you know that you can get the vaccine? If you are 18 and above, then all of us are eligible for getting the vaccination. The other common question is, can I take one vaccine like Covishield and then take the second dose of Covaxin? The answer is you cannot. If you have taken Covishield, then you have to take Covishield, and if you have taken Covaxin, you need to take Covaxin. Commonly asked question is, what do you do when you go to get your vaccination done? Please make sure that whenever you visit the vaccine center, you are properly masked. You don't communicate to everybody. You maintain adequate distance, because there is also gathering of people, and you must make sure that you don't go to the vaccine center and expose yourself to the possibility of getting infected. Which virus is better? Which vaccine is better? People keep asking. Both Covishield and Covaxin have been reliably proved to be effective. So both of them are as good as each other. The other question which people normally ask is, do I need to wear a mask after vaccination? Yes, you need to continue to wear mask, because people who are, despite having vaccines, sometimes get infected, though the effect of the disease is much less severe. But to prevent such events, it is important that you mask up. People say that normally asked questions is, how long will it take for me to be immune? The present information or the knowledge available is that it takes around 2 to 3 weeks from your second dose to develop antibodies against the virus. So that is what it is. So after your vaccination also, second dose, it takes around 2 to 3 weeks. So you need to be extra careful within that period. And these are the most of the questions. If you have any other questions, please let me know. Let us know at INC or Facebook or Twitter. My name again, I said, is Dr. Ajoy Kumar. You can even tag me on Twitter and ask those questions. My request once again, thanking you for your support, and let's go ahead and vaccinate India. Thank you. Namaskar.